month's town hall meeting. I hope you all have been recovering well since the flood 2 weeks ago. The focus of this meeting is going to be reviewing and editing the current flood disaster plan. I believe the community as a whole believes that this plan needs to be amended and approved. I would like to open up the floor to the community at this time.
Mrs. Mayor, I just feel that our current community plan does not take into account the elderly population. If not for my children calling to warn us and helping us, I don't know that my husband and I would be here today. We don't use Facebook and don't have fancy cell phones. We used to get all of our weather information from the TV, but my vision has gotten worse. My husband is hard of hearing, so that has become more difficult.
I understand, Ms. Smith. Thank you for voicing your concerns. What would you think is the best way to communicate with the elderly population regarding impending disasters?
Well, I like to talk to people on the phone. I think that would be the best way for me to get information quickly.
Perhaps we could create a list of people in the community who would require a direct call regarding impending weather and disasters.
I think that would work really well. Many of those in the hospital from the flood are the elderly who were not aware that the weather was supposed to be that serious and were caught off guard. We have to improve our communication.
That is a great idea. We could have automated messages sent out and offer a callback number for people to call and get additional information.
I do have another concern. Thankfully, our son brought us a generator. Otherwise, how would my husband do his breathing treatments? What about those who don't have electricity but need it for health-related reasons? Not everyone is as lucky as we are to have family to help.
I agree with Mrs. Smith. It is very concerning to think that our patients who are technology dependent may suddenly not have life-sustaining resources should the power go out. We need to include precautions and an action plan for this population in our disaster plan.
I think that if we increase communications efforts, that could help mitigate the results of the loss of power by enabling the community to take action sooner, such as evacuation. Mrs. Mayor, it may be beneficial to have several buildings set aside for people to come to who need electricity, such as local public schools and community centers. If we took early relocation action prior to the onset of impending weather, we could prevent complications caused by loss of power in the technology-dependent populations.
Early relocation would be very beneficial. Typically, we don't start relocation until after things happen and therefore are not able to transport everyone who needs it. We can make sure to only allocate buildings that will have generators available. We will need to create a priority list for populations to relocate first, second, and so on, as well as a plan for how to reach out to them.
My husband and I would use that resource in the future if it works out. I hate to put my son in danger by relying on him to come get us during disasters like this past flood.
I can reach out to the technology-dependent patients that I work with and work on creating a list of those that may need these services.
In the clinical setting, we try to take advantage of every opportunity for patient education. Is there any way that we could educate vulnerable populations? I was thinking about speaking with case management at the hospital and asking them to include an assessment portion regarding disaster preparation and resources.
That's a great point. The more information available to the public, the better. I can work with the local social work agencies as well as reach out to the hospital administration. This will allow us to educate them and offer available resources and assess what these vulnerable populations may need.
If we all work together and stress the importance of this problem, we can likely get more government grant funding so that we can also gather supplies for the designated shelters.
We can also advertise the need for medical volunteers to staff the shelter during that time should anyone in the shelter become ill or injured. I know that many of the nurses at the hospital I work with would be willing to, especially after seeing the devastation from this past flood and the impact it has had on our patients.
I have friends in the local nursing home which lost power for a few hours during the flood. From what I have heard, it turned into a madhouse. Is there anything that can be done to prevent that?
I believe the problem there was that the generators were not working properly as it had been many years since they were last used. That's a great point. We need to assess the healthcare unit's ability to provide backup electricity if needed. FEMA offers funding for generators for public health institutions. That is something we should look into, as well as routine maintenance for all of the generators, as they should be checked more frequently.
I think all of these are great suggestions. Let's talk through the disaster plan with these additions. I believe that we first need to identify the most vulnerable populations. I know we spoke about those that are technology dependent and the elderly. Can anyone think of any more?
I think in addition to the elderly, children should be identified as a vulnerable population that may need more assistance and services. I know that those in high-risk areas, such as those who live in lower elevation, are already addressed in the current disaster plan.
I agree. We should also consider the homeless and poverty-stricken populations who have limited access to resources and transportation.
Well, thank you all for your input. We will begin to make plans and implement them to fix these problems. I look forward to the next meeting in 1 month to speak about this topic again.
Thank you.
Thank you.
So let's go through the entire flood mitigation disaster plan with the new ideas that we spoke about last month included. Our first priority should be to save the lives at imminent risk, including the vulnerable populations we just spoke about. We are in the process of allocating government fundings and grants to use to create a new and more efficient notification system. Thank you again, Ms. Smith, for voicing your concern at the last meeting and suggesting that we also notify by phone.
I'm so happy to hear that these changes are being made.
We will also be using the previous communication effort, including VDOT signage and emergency radio and TV messages.
I've been speaking to healthcare facilities, and several of them have installed new flood drainage systems. Additionally, many facilities have also hired routine biannual generator maintenance. I'm going to repeat that. I've been speaking to healthcare facilities, and several of them have installed new flood drainage systems. Additionally, many facilities have also hired routine biannual generator maintenance.
We've gotten approval to use 3 of the local schools for emergency shelters as needed and are in the process of using government funding to supply these locations with generators and medical supplies should another disaster occur.
I know that we have many volunteers for the medical care disaster programs that will be implemented in these shelters. We are currently in the process of putting together educational programs for these volunteers so that they are more prepared.
In addition to emergency medical training for volunteers, we're also going to be offering free optional education for all community members. These courses will include basic medical skills, training on the current disaster plan, and education regarding available resources in the case of a disaster.
My husband and I just signed up for one of those courses.
I've spoken with the NFIP, or National Flood Insurance Program, and we have reconstruction efforts underway for eroded land and damaged property. We are working with both NFIP and FEMA on getting it repaired as quickly as possible, as well as installing environmental structures to decrease flood damage in the future.
Well, I think these updates fit into the previous plan perfectly, and I'm looking forward to continuing to work with you all as new topics and ideas come up.
Thank you all for coming today.
Thank
Thank
you.
you.
We're talking about Lewin's change theory in our assignment.
The unfreezing aspect of change theory that we used in our video was the physical flood itself and the devastation that was seen within the community, and how neighbors had to firsthand witness how their community members had been impacted.
Yeah, I think that the damage, like lives lost and the overall community impact, made the need for change really obvious. Second part is movement. That was the first town hall meeting where we all got together to just identify the changes that we saw independently and like bring it all together. What were some of them? New communication system.
Implementing shelters and
Yeah.
generators,
Mhm.
the actual physical planning part.
Identifying vulnerable populations, and then creating a plan. And then the third part, refreezing. That was town hall meeting 2, and we just kind of reviewed the ideas and the status of the implementation, how that was going. What else?
And then there was intent to follow up with the program
Yeah.
and track its progress.